So Alzheimer's disease was originally discovered by Dr. Alois Alzheimer in 1915. He was able to identify that there was something unique about one of his patients, and it was very advanced aging compared to the general population at the time. And he was able to, in 1906, he actually discovered that there was something specific going on with the brain. So Alzheimer's disease is just one of the dementias. It is not a normal part of aging. And just in the last 20, 30, 40 years, we've been able to identify a lot more information than when it was originally discovered in 1906. It is not curable like cancer in some cases. It's not manageable like diabetes. You know, if you get diabetes, you go to the doctor and they can provide education for how to manage diabetes, and it can help you better manage the disease that you have. But if you have Alzheimer's disease, you can't stop the progression. You have to learn as a caregiver how to deal with it. If you have Alzheimer's, it's harder for you to be able to figure out how to manage the disease. It's not reversible. It's not treatable like mental illness. If I have Alzheimer's disease, dementia is the symptom that is the cognitive loss. So like memory challenges or confusion with time and place, those are examples of the symptoms, and the dementia is the symptom. Today in the United States, it is the 6th leading cause of death. There are more than 5 million Americans that currently are living with Alzheimer's. And because it's progressive, and because we have an aging population, by the year 2050, this number could raise as high as 16 million. So this slide just shows the continuum of the Alzheimer's disease. So again, in the early stages, when that damage is happening, people can actually have Alzheimer's disease, but they don't know it. So they're not symptomatic. And they've even done some studies to be able to identify when somebody does pass away and they do an autopsy. There have been people that had the plaques and tangles that many of you have heard about in the brain. They clearly had the biology of Alzheimer's disease, but they didn't have any symptoms. So they're doing a lot of research of why would that be. So somebody could have the damage happening for many years and not have any symptoms. And so they've been able to identify that people with higher levels of education are less symptomatic, and it seems to move more slowly on average than those with less education. People who have a better diet have less progression in symptoms. So they've been able to identify there are many things we can do to reduce our risk and perhaps delay the onset of symptoms. So if it's going to happen in me at age 75, let's say, but if I choose some really great healthy lifestyle choices, and I'll give you the list of some of those, then maybe I won't get symptoms until I'm 80. So could I delay the onset 5 years? Would that be worth it? Well, absolutely. So a lot of the research is showing that we can reduce our risk or delay the symptoms, or even if I get a diagnosis, maybe slow down the progression. Some of our colleagues who have the diagnosis tell me that when they exercise, they feel better. And evidence is showing even if you get a diagnosis, if you use regular, the recommended amount of exercise, 30 minutes a day, get your heart rate up a little bit. You don't have to become a marathon runner. Just pick it up on exercise. It can help you live better longer. So have a better quality of life and maybe slow down the progression of the disease. And so here's the 10 warning signs. So should you notice any of these things, you should see a doctor. This means that somebody is starting to have some of the symptoms. And as I mentioned, the Alzheimer's disease, there's 5 million people with the diagnosis today in America. They're all different. It moves through the brain differently in every person. So they are going to come in different orders. There are some similarities in most people. However, it's going to be different in every person as well. And so it's important to have really good communication. That's the best way to care for somebody. A social connection is critical for all people. As we age, staying social can help us improve our health care. And it's even more important with those with dementia. We need to have meaningful interactions. And so we should ask them what is meaningful. When somebody gets a diagnosis of dementia, we need to find out, what is it that they love? What's really important to them? You know, we all choose and live our lives the way we want to, and we get to decide that. We still need that if we have dementia. So sometimes folks with Alzheimer's disease have challenging behaviors, and typically what that means is something is wrong. It's either physically or emotionally, something is getting in the way, and they don't have the ability to tell you what is wrong. So some of the challenging behaviors are a way to communicate. It's their only way to tell you something is getting in the way. Folks might be irritable or anxious or depressed. They might have sleep changes, physical or verbal outbursts, emotional distress. Again, something is wrong if any of these things are happening. They typically don't need medication. We need to figure out what's wrong, eliminate that, and those behaviors will go away. We need to understand the behaviors, and here's some just tips on how to figure that out, is what happened just before the behavior happened. Sometimes there's triggers that cause those challenges. How frequently does the behavior occur? So these are just some tips to be able to narrow that down and try and figure out some ideas of what do we do if you see some behaviors that are a little bit different or confusing. We can find many ways to respond, and so that's one way you can learn more. Is the Alzheimer's Association gives people tips. We have an 800 number that you can call anytime, 24/7, to be able to ask, this is happening, what do I do? And we have licensed social workers on staff. Or ask your doctor or the social worker where you see a doctor, and they can help you try and find solutions to find ways to respond. You don't have to just say, there's nothing I can do, I don't understand. Being able to learn more about the symptoms and what you can do about it can help improve the quality of life for both the person with the diagnosis and their care partners. This is the best thing I've learned since I've been with the association, is that emotional memory matters and it lingers. And so this is a quote from Maya Angelou. She says that I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Well, this is even more important when people have Alzheimer's disease or another dementia. Emotional memory is not lost with this memory loss, with this disease. While a person with dementia will lose cognitive memory, they will not lose how you make them feel. So they might not remember that you visited, but they remember somebody visited and I feel good, and that will linger. So that matters. Emotional memory also matters, that they remember the icky ones too. So if you have an argument, they're going to remember something icky happened. The negative emotions will linger too. So if that happens, it's even more important to stop, walk out of the room, adjust your attitude, put your smile back on your face, and come back and try again. Because they're going to remember how you make them feel. So connect in that positive way. Create moments of joy. And if things aren't working, stop, readjust, start again, and come back and have a more positive experience.